This reporter went in search of details about the viral video in which mothers who have babies were left unkempt and sleeping on a corridor in LUTH, but chanced upon another story, that of poor welfare, not for patients, but for the very staff who keep the hospital running. This category of workers are employed in an arrangement where an agency called Initiative recruits on behalf of LUTH. This is unlike that of actual staff who are bona fide staff of the institution. There are more than 2,000 Initiative staff, but only a handful come forward to tell their story on behalf of the rest. Because of the fear of victimization, they have all chosen to remain anonymous. During this first set of interviews conducted in December 2020, 3 anonymous workers who have been with LUTH for between 5 and 14 years speak about their grievances. They are especially disheartened by the deduction of half of their salaries over a period of 2 months by management, which cited COVID-19 exigencies as reason for the deductions.
May 23rd, 2007.
Employed
as a locum staff.
Okay.
Because then they are looking for a locum staff.
Okay.
So at 2011, they gave us a paper in form of retrenchment forcefully. They now give us another paper to reapply.
So this on the 15th. We have not seen salary. All the workers in LUTH have paid. What is wrong with our money? When we go there, they will say that CMD have not signed it. When we go there, say it's in their account. When we go there, till when we started fighting, shouting, the crisis, then they will come and say they are going to drive us away. They write our name with pencil. They are doing this. I say, without us, doctor cannot work. I'm there since 13 years now. Working 13 good years. Nothing I benefit from that place.
That's one pariwo pé kàn fi kówó wa ló wá sọ di 30, that's 29 tangba. Àgbàlẹ̀ kìíní èkejì, bàtò máa délẹ̀ kẹta, that's no COVID. Ẹni tí wọ́n bá dé pé kò fẹ́ kò máa lọ.
This category of casual staff employed by LUTH's initiative system earn a meager 30,000 naira, an amount only made possible in early 2020 after President Muhammadu Buhari assented to the new minimum wage bill. Before that time, they were on a miserly 15,000 naira, which they earned for the better part of their service with LUTH. Even now, as fathers and mothers with dependents, 30,000 naira is a travesty of a living income. They tell me how they pass the night in the office for days just to save the cost on transportation. The COVID-19 deductions were made in March and April 2020, while interviews were conducted in December 2020. I waited for about 3 months, during which I followed up with these informants. By March 2021, when I returned for more interviews, the deductions had not been refunded. This time, more aggrieved workers were available to share what seems an unhappy work experience with LUTH.
Before they pay our salary, around they will pay maybe 20 on the 15, 16, 17 before they pay salary. So I don't know where LUTH say 45 days on the calendar. So then allowance, nothing like allowance.
That 5,000 we collect like 2 months before COVID starts. After the COVID, then pay us half. Even the half, we don't work like 45 days before they pay the half. It's supposed to be 4 or 5 in shift, so it will be only 2. How 2 persons go supply all the world?
Apart from the COVID-19 deductions, these aggrieved workers add that they are denied other allowances that the bona fide medical and non-medical staff are given.
When they calculate the outside for 5,000 in a month, which is 60,000 in a year, we do not see anything.
Presenting a document that shows a list of the contract staff and a disparity in remuneration, the workers queried the discrimination in salaries.
This is somebody that I knew that they just employed. He's telling me he's receiving 45,000, the same job.
They also decry what they consider poor conditions of service.
Nothing like hand glove, boots, or uniform, nothing.
We don't have boots, we don't have anything. They don't give us any overall, we don't have anything.
This is an autoclave machine used to sterilize work tools in treatment wards. According to information, it is over 30 years old. While my informant assures me that it is functional and only requires repair and regular maintenance, this is what a modern autoclave machine looks like. And whether management does not consider this a priority or money hasn't even been allocated to secure a modern one has remained an important question. It would not be out of place, however, for LUTH management to consider replacing the 30-year-old autoclave machine. A medical doctor in senior cadre with LUTH confirms most of these concerns raised by the disillusioned workers. Pleading anonymity as well, she points out that bona fide staff of the teaching institution also do not receive benefits like loans or the privilege of free health care.
Whether or not the government should be employing contract staff, whether or not the Nigerian labor laws favors that, and then also what exactly are the terms of this engagement. I mean, we have these people working for years, there is no promotion, there is no, I'm not sure that they are enrolled in the pension scheme.
Despite their long list of grievances, these workers are not allowed to unionize because of the contractual nature of their employment. Comrade Adegoke Monsuru is a senior management staff of LUTH and publicity secretary of the Trade Union Congress.
These people that are employed by this company, LUTH Initiative, they desire to be part of the union. Anytime the union is under any action, they want to be part of it. But because they are not allowed to unionize by, I don't know by what guess, but maybe because they are not employed as permanent staff and job security is not there, so they are afraid. There is provision in Nigerian Constitution for freedom of association, and not allowing them to unionize is depriving them of that fundamental human right as Nigerians.
Lawyer and senior advocate of Nigeria, Olatunde Adejuigbe, defines the rights of these workers within the context of the law.
What LUTH has done is not different from what we tag casualization, which is an unfair labor practice in the sense that you cannot keep people in that kind of casual employment for a long period of time. You see, the concept of casualization stems from the fact that you can fill some vacancies in your employment for a short period. Either somebody is away on study leave, somebody is on maternity leave, or sometimes what you call a relief worker, which must be understood from the beginning that I'm going to be filling somebody's position, so to use that expression, like standing in the gap for 3 months, 6 months. But when you have a relationship that has spanned about 13 years, I mean, that is not the intention of the labor law.
Adejuigbe also provides an insight into what the aggrieved workers' chances are should their case be taken to the National Industrial Court.
Under the Section 254 of the Constitution, which vests jurisdiction in National Industrial Court, it allows them, to resort to international best practices. And that is why you have seen that there have been cases where a woman who was, whose employment was terminated because she was going on maternity was reinstated.
TVC News has reached out to the Public Relations Department of the Teaching Hospital for an explanation of its position on the concerns raised by the aggrieved workers. After repeated calls to one Mr. Pius Ewa of LUTH's Public Relations Department, he promised to call back after making arrangement with the management staff to grant my interview request. I am still waiting for the callback. 2 out of the 8 conventions from the 1998 ILO Convention on Workers' Rights are relevant to these aggrieved workers. They cover subjects considered to be fundamental principles and rights at work, including freedom of association and the effective recognition of the right to collective bargaining, and the elimination of discrimination in respect of employment. Nigeria is signatory to the 1998 International Labour Organization's Declaration on Workers' Rights. Hence, the Lagos University Teaching Hospital, LUTH, being one of its leading healthcare institutions, ought at least to be found doing what is right by ensuring that these workers who appear forlorn in countenance and appearance, are rendered their due. Bukola Samuel-Wemimo, TVC News, Lagos.